We were started 20 years ago by people who cared that those in their community, their neighbors who didn't have access to dental care, needed that care. And they came together and created Sonrisas from nothing.
What I heard from board members after I joined the board was that a group of people were horrified at the condition of children's teeth on the coast side. So a group of people who are connected with healthcare, people like Judy Macias and Maureen Perron, and the local doctor, Dr. Ray Shepard, decided they had to do something about it.
There was no access to dental care for really low-income children, especially for undocumented children, and they would have to go over the hill to a county dental clinic if they were even eligible for any kind of service, and many weren't. I was able to get a $30,000 grant, and with that money, we formed a small grassroots of people.
We saw kids with just many infections and parents not able to find a place to seek care. There was no dental county clinic, and it would mean going over the hill, and that was difficult for families where both parents were working. So it was really from that we got the idea, the dream really, to start Sonrisas.
And they tried having half-day clinics twice a week or something like that, and they realized it wasn't enough. And therefore they decided they had to set up a clinic devoted to providing dental health care and education to people who couldn't otherwise access it.
And so the more research that we did, the more we found out a couple of things. That one, it wasn't just access to good dental care, but it was also the impact of poor dental hygiene on the entire human body. That brings up a lot of educational need in our community. And Sonrisas has been doing that. They've been going out to the schools trying to educate people that it's not just how your teeth look, but it's other things that are affected by how your teeth look. And I think that's one of the tremendous aspects or assets of Sonrisas Health.
It's life-altering for people. People, I think, they start to take care of themselves better with their mouth. They'll find they start to feel better, and it will make a difference in how they see themselves, particularly for a lot of the really hard cases that they're so embarrassed they never smile. So lots of adults are like that too. They don't smile. They're ashamed of their teeth. But that was a big aha moment too for everyone.
And it's interesting because those screenings for education were education as well as looking at the kids' teeth. And every time we looked at the kids' teeth, we always found 3 or 4 emergency cases. Kids had just had no treatment, and typically the nerve ends were showing on their teeth, and it's amazing that they managed to concentrate in class.
When I see some of the stories that Dr. Ju or some of the staff members present to us, I mean, it does take your heart and rip it out. Sonrisas is in the trenches. They have been in the trenches for a long time, largely unknown in San Mateo County, and now it's finally getting some visibility that it should have had years ago.
We want to live in a county where there's not kids who are in pain so that they can't go to school. We want to live in a county where families have access to excellent dental care. And it takes the whole community coming together and supporting an organization like Sonrisas to see that that happens. That's what's so special about Sonrisas.